listening to RMG Talks, Personal Injury Leaders in Georgia Medical.
Everything you need to know about soft tissue injury cases. Getting injured in an accident doesn't always mean you'll experience bleeding and broken bones. Many types of common injuries may not be so noticeable. You must take the necessary steps to make sure you get the care that you need in case you end up in an accident. Familiarizing yourself with some of the more common injuries can help you understand the importance of seeking proper medical help. What is a soft tissue injury? As the name suggests, soft tissue injuries refer to incidents where soft tissues were damaged. These injuries can manifest much differently than other traumatic injuries, such as fractures and lesions. Soft tissues, such as muscle, ligaments, and tendons, are vulnerable to damage. These injuries mostly occur through two separate scenarios. The first is that overuse of the soft tissue causes your body to become painful or even damaged. You can also experience soft tissue damage acutely through accidental trauma. Anything from a trip on the sidewalk to a motorcycle accident can result in soft tissue damage. Soft tissue injuries vary significantly in terms of severity. No matter how severe your symptoms are, it is always wise to seek medical treatment. Some soft tissue injuries are more common than others. Types of soft tissue injury. Consider the following most frequent types of soft tissue damage. Sprains. Sprains are the phenomena excessively stretched ligaments or pushed to the limit or even torn. Ligaments are responsible for keeping your bones connected. The most common places to experience a sprain are the ankles, knees, and wrists. Symptoms of sprains include laxity, when your joints are abnormally loose, pain, swelling, bruising. Strains. Strains refer to an injury to the muscle or tendon. Muscles are responsible for aiding with body movement, where tendons connect muscle tissue to bones. Following an accident, it isn't uncommon for someone to stretch or even tear their tendons or muscle. One of the most common places to get such an injury would be in the back or leg. Victims of strains may experience the following symptoms: back pain, muscle spasms or weakness, inflammation near the affected area, cramps. Whiplash. One of the most common injuries someone that underwent a traumatic accident experiences is whiplash, also known as a neck sprain or neck strain. It's an injury that occurs when someone jolts your neck violently. Whiplash is very common if you end up in a sudden crash and your seatbelt protected you from slamming forward. Whiplash is experienced by people very differently. Where some people feel an immediate sharp pain at the time of the collision, many experience delayed symptoms. In some cases, people may not even recognize any pain for several days. Common symptoms of whiplash include muscle damage, ligament damage, headache, fatigue, cognitive abnormalities, memory loss, sleep disturbances, dizziness, pain in the back or shoulder. Contusions. You probably recognize contusions by their common name, bruises. Bruising is caused by trauma, which managed to crush tissues under the skin. The blood then pools underneath your skin at the site of the injury, creating a purplish color. Some people may bruise more easily than others. Excessive bruising can be the sign of a serious underlying medical condition. Pain or tenderness at the site of injury, discoloration of the skin. Overuse injuries. Soft tissue injuries obtained through overuse are a little different than those incurred through an accident. Tendinitis. When you stretch out your tendons repetitively, you risk aggravating them to the point of damaging them. You need your tendons nice and healthy to maintain optimal movement and strength. Bursitis. Small sacs that sit in between bones and soft tissues can become inflamed when someone constantly aggravates them. These sacs, known as bursa, are responsible for acting as a pillow to prevent erosion and friction. How do you treat soft tissue injuries? There is a whole range of techniques that experts use to treat soft tissue injuries. In severe cases, doctors may recommend medication or surgery. Many times there are holistic approaches one can take to treat their soft tissue injuries, such as icing or seeing a chiropractor. Do I need to see a doctor after an accident? What is the first thing to do after a car accident? Visit a doctor. Even if you don't believe your injuries are severe, you need to visit a medical professional to gauge this accurately. There's a chance you may be entitled to total compensation for your injuries. If you fail to go to a doctor, you may overlook significant symptoms that require immediate medical attention. Continuing to use or add pressure to damaged bodies can result in permanent or more severe injuries. If you cannot see a doctor immediately, call an office for medical advice. Icing injuries is often a great way to reduce the pain you feel while you wait for an appointment. In the case of a potential lawsuit, be sure to document the progression of your injuries and keep all medical files. These photos are crucial for evidence. We understand the entire process can be a bit overwhelming, but there are people here to help. Our team at Regional Medical Group is here to help patients deal with their medical treatments after an accident. Our pain management doctors are experts in the field who want to get you the treatment you need without having to stress about the cost. How can I stay updated on accident-related information? RGM aims to close the gap between our clients and expert advice when they need it. That is exactly why we launched this podcast channel. Regional Medical Group launched a new podcast series called RMG-TALKS to connect with our audience at home during these uncertain times. RMG-TALKS is a personal injury medical and law informational podcast channel that offers next-level entertainment and business news to its listeners. Hosted by our RMG team, we are now streaming on all major listening platforms. Start listening at rmgtalks.com.